My pep talk today is entitled Safety Promotion Program Against COVID-19, Avoiding COVID-19 Infection at All Costs. There is a COVID-19 pandemic going on in the Philippines as well as in other parts of the world, as declared by the World Health Organization, WHO, since March 11, 2020. As of May 7, 2021, in the Philippines, there are now more than 1 million cases of COVID-19 and more than 18,000 deaths reported. COVID-19 is a preventable infectious disease. It is not worth dying from it. All of us must know how to avoid getting infected with COVID-19 at all costs, as once you get infected, you carry a risk of dying from it. Nobody can predict with 100% certainty whether you will recover from the COVID-19 infection or not once you get it. Remember, COVID-19 is 10 times deadlier than influenza, and the course is unpredictable and treacherous, especially for the older people and those with concomitant chronic medical diseases like diabetes, heart disease, hypertension, asthma, and other respiratory diseases. To have a safety promotion program against COVID-19, know first what COVID-19 is, how it spreads and gets to you, what are the symptoms for you to recognize it, what are the ways to avoid getting infected with it. COVID-19 stands for coronavirus disease discovered in 2019. COVID-19 is caused by SARS-CoV-2 virus, a respiratory virus. As such, spread is from person to person, mainly through the respiratory route after an infected person coughs, sneezes, sings, talks, or breathes. Persons infected with SARS-CoV-2 may be symptomatic or asymptomatic. Asymptomatic persons can also transmit the virus to other persons. There is a range of symptoms for COVID-19 that is hard to differentiate from influenza and other respiratory tract infections. The range of the more common symptoms of COVID-19 appearing singly or in multiple combination consists of the following: fever, dry cough, tiredness, sore throat, cold, headache, body pain, loss of smell, loss of taste, diarrhea, nausea and vomiting, skin rashes, red eyes, difficulty of breathing, etc. How not to get infected with COVID-19? The most effective preventive measure is to avoid exposure to the virus and to stay away from the virus. Avoid exposure to people with possible, suspected, and confirmed COVID-19. Avoid exposure to plenty of people with possible COVID-19. Avoid exposure in a community with COVID-19 outbreak. At this time of COVID-19 pandemic, consider all people to have possible COVID-19, even if they don't manifest symptoms of COVID-19, and even if they have a negative COVID test. Consider all people to have possible COVID-19. Do not go near them. Stay away from them. Stay away from the virus they may harbor. If for one reason or another, face-to-face interaction cannot be avoided with individuals persons with possible COVID-19, wear face masks and a face shield when interacting with every person with possible COVID-19, practice physical distancing with at least 6 feet away to every person with possible COVID-19, interact in open, naturally aerated space, not in an enclosed room, not in an air-conditioned room. Interact in the shortest time possible, no more than 15 minutes. Wear additional personal protective equipment or PPE if face-to-face interaction of 15 minutes and physical contact cannot be avoided. Practice hygienic measures of washing hands after touching things handed from another person and taking a bath right after doing face-to-face interactions with people with possible COVID-19. Another safety measure, avoid complete face-to-face interaction with persons with suspected and confirmed COVID-19. Stay away from them, stay away from the virus they may harbor. Still another safety measure, prophylactic measures should be added to the preventive measure of avoidance of exposure to the virus. The most effective prophylactic measure to prevent development of COVID-19 disease in case exposure cannot be avoided is building and maintaining host resistance against COVID-19. Currently, there are 3 effective prophylactic measures. 1, building and maintaining your innate immune system. Innate means inborn, native, naturally existing immunity in the body. 2, controlling all existing chronic medical diseases such as diabetes, heart disease, hypertension, bronchial asthma, and other respiratory diseases. And 3, building and maintaining your adaptive immune system. Adaptive means specific or acquired immunity such as formation of antibodies to fight against a foreign body or antigen. For building and maintaining your innate immune system, practice living a healthy lifestyle, which consists of adequate rest, nutrition, hydration, exercise, stress management, and personal hygiene. For nutrition or for rest, have at least 8 hours of night sleep with afternoon siesta as much as possible. For nutrition, eat healthy natural diet, adequate but moderate in amount, balanced, and varied. There is no need for additional vitamins and other supplements. Hydration, drink at least 8 glasses of water per day. Exercise, at least 1 hour a day, distributed over the day, doing walking, stretching, and flexing exercises. For controlling all existing chronic medical diseases, follow the medical advice of your current physicians and make sure that they are all under control, the medical conditions. Take note that persons or patients with existing chronic medical diseases are at higher risk for severe COVID-19 diseases and death. For building and maintaining your adaptive immune system, have an anti-COVID-19 vaccination as soon as possible, as soon as available, to generate antibodies against COVID-19. Take note that vaccination has been shown to decrease the risk of severe COVID-19 and death at best. And aside from this, vaccination has been shown to decrease the number of COVID-19 cases as actually experienced in Israel and other countries. Another important advice on vaccination, even with vaccination, one has to continue practicing the physical preventive measures and building and maintaining the innate or natural immune system until COVID-19 is fully or totally controlled in the community or in the world. So takeaway from this pep talk: one, COVID-19 is a preventable infectious disease. Thus, it is not worth dying from it. Avoid COVID-19 at all costs, as there is always a risk for death once infected. The most effective preventive measure is to avoid exposure to the virus and to stay away from the virus at all costs. The most effective prophylactic measures to prevent development of COVID-19 disease in case of exposure cannot be avoided are building and maintaining your innate or natural immune system, controlling all existing chronic medical diseases, and building and maintaining your adaptive immune system through anti-COVID-19 vaccination. This ends my pep talk. Mabuhay!